helping you to stay sane during COVID-19 with a few mental health tips, plus an update on the coronavirus from the government, and a progress report on the Port Royal 2020 Sustainable Development Plan. The details right now in this edition of Jamaica Magazine. I'm Adrian Atkinson. We now give you the latest details on government's COVID-19 containment measures.
Let me just begin by saying that Jamaica has recorded its third COVID-19 patient death. The third patient is a 41-year-old male from Westmoreland who had a travel history from the UK. He tested positive on March 23rd. He had some underlying conditions, and experienced renal failure, and regrettably passed away today, earlier this afternoon. The second patient, who died yesterday, cause of death is still under investigation, and we did send out a statement with some particulars, but we are going to reserve final conclusion until those investigations are completed. Jamaica now has a total of 44 confirmed cases of COVID-19. Today we received information from the National Influenza Center, which advised us of 6 new confirmed cases. This represents the highest number of positives we've had in terms of a batch of tests. Except though I'd like to just say that we did quite a number of tests. I think it was 53 tests. So of the 53, 6 are positive. All of the 6 positives are linked to the quarantine community in southeast Clarendon of Cornpeace. One of the 6, a 53-year-old male, had traveled with the index case, so has a travel history from New York. And you will recall that that index case was the first person, a 79-year-old male, to have passed based on the impact of the virus. So we quarantined the community. Our team has been on the ground. We have carried out tracing. We have identified persons, and we have done a number of tests. And in this instance, 6 of those tests have come back positive. The reality is the most effective way to control the virus's spread, or to flatten the curve, is for people-to-people contact to be kept at a minimum. And I think the Cornpeace experience is an indication, again, of why it is that we have to insist on compliance. And while I believe a number of Jamaicans are, I think it's fair to say, based on what we have seen and heard, a number of Jamaicans are not complying.
Of all the confirmed cases that we are seeing, it is the cases that have very severe symptoms that are likely to cause more infection in their contacts. So most of the cases that we've seen have had mild symptoms, and the pickup rate from their contacts are very, very low, almost none in some cases. The cases that have had severe symptoms, those are the cases where they're very close contacts, we're getting a high pickup rate. So I think based on what we're seeing, the network that we have spread across the country to detect, I think that we are able to detect what is happening in the country and therefore be able to respond to whatever happens. So of the 44 positive patients that we have, 2 were sent home, as you know. We announced the third patient that died, and we have 27 persons that are presently asymptomatic. Now, those persons that are asymptomatic, the number of days vary. So we are allowing 4 asymptomatic days before we do the first test for discharge. So we have some persons that are still within those 4 days, so they have not done their first test yet. And then we have some that have done a first test and some that are waiting on a second test. We have 8 persons that we would classify as having moderate symptoms. And by moderate symptoms, what I mean is that they are on oxygen therapy or they are wheezing. And we have 6 persons that have mild symptoms. And by mild symptoms, I mean that they have a sore throat or a dry cough.
So Clarendon, it's 10. Hanover, it's 0. Kingston and St. Andrew, 12. Manchester, 4. Portland, 1. St. Anne, 5. St. Catherine, 4. St. Elizabeth, 1. St. James, 4. St. Mary, 1. St. Thomas, 0. Trelawney, 0. Westmoreland, 2. There are 24 imported cases, 17 imported related cases, and 3 cases under investigation. In terms of the age, the average age of the confirmed patients is 51 years, ranging from a minimum of 12 years to a maximum of 87 years. And there are 21 females and 23 males who have been confirmed as having COVID-19 to date. In the meantime, we have 44 persons who are currently in isolation. 24 persons are under quarantine in a government facility. In addition, of course, to the 140 Cuban health professionals who are being quarantined, I think, until this weekend, when they will be allowed to engage the public health system to bolster our frontline defense to persons we have to treat with linked to the coronavirus. In terms of testing, we have done some 442 samples, including the samples that were tested for severe acute respiratory infections. 44 of that number would have tested positive, 394 negative, and we have 4 results that are pending. We hope to get the results of those later on today, if not tomorrow. What this shows, therefore, is that we have a positivity yield of 10%. So of all the tests that we have done to date, all 442, we have approximately a 10% yield, which by international standards is good. Having reviewed the protocol, we have had consultations with senior virologists and infection control specialists, of course, guided also by the WHO, PAHO. We are of the view that the testing has been sufficient to date in giving us an indication of the virus or the presence of the virus in the population. It has allowed us to monitor our healthcare frontline workers because they're also part of that protocol of testing. And the more general testing that takes place for persons who have respiratory ailments and are in hospital but have no link to a positive case, we include them in that sampling. All combined, therefore, we think that we have a good sense of what is happening on the ground, and we are encouraged to date by the numbers. I'd like to announce that between now and the weekend, I think on Friday, we should be in a position to roll out a mobile testing mechanism. The ministry will be essentially engaging mobile units, which will be branded to indicate their purpose. And those units will be deployed in parishes across the country. We're going to begin in the Southeast Regional Health Authority, SERA, and Northeast Regional Health Authority region. And there will be a protocol assigned to the deployment of those mobile units where persons who have a desire to be tested would be subjected to that protocol in terms of an assessment done or triage, as would be done in an accident and emergency context. And if they meet the specific requirements or criteria, then the samples would be collected by those units and tests administered, and they'll be contacted and given appropriate counseling and guidance. This will increase tests across the country and will give an opportunity for persons to volunteer for testing. We have an app that is also going to be published that would allow persons to use a technology platform to also sign up if they think they want to be tested. Just to say, though, that the fact that you want to be tested doesn't mean that you will be tested. It's a function of the clinical assessment that would be done and the counseling that would be done. In terms of community quarantine, we continue to have the Corn Peace settlement in Clarendon under quarantine. The residents have been supportive.
We really are monitoring 50 households in association with the first positive person from the Corn Peace settlement. The majority of those households are within the Corn Peace settlement, and then we have additional households that are in Portland Cottage, Longville community, and in Hayes. For those 50 households, we have interviewed over 250 persons, and there have been about 30 persons that we have identified as close contacts to the first person that was positive and then the second related contact that was positive.
In terms of home quarantine, the ministry would like again to remind travelers who have come into the island between March 18 and 23rd, 2020, from countries where there is local transmission, that they must self-quarantine for 14 days and, of course, report to the Ministry of Health and Wellness using the portal jamcovid19.moh.gov.jm. That's jam, COVID 19.moh.gov.jm. If you develop symptoms, of course, you can call the 888-1-LOVE or 888-663-5683. I'm happy to announce that the Andrews Memorial Hospital will be used based on an agreement as an extension of the Kingston Public Hospital. So as needed, patients who are admitted at KPH would also, if necessary, and based on the appropriate arrangements, be housed at Andrews Hospital.
Each hospital was required to clear a ward to provide support for COVID. KPH is one of those hospitals that was identified and have responded by clearing at least 2 wards. This has reduced their capacity to treat with other patients who are probably medical patients or surgical patients. And so the plan that was agreed to with Andrews is that those medical and surgical patients who could be admitted to Andrews as an extension of their admission to KPH would be housed or would be accommodated in their facility.
In public health, we continue to provide updates between those 2 briefs to ensure that the public gets as much information as possible, to be extremely transparent around this process, and hopefully in so doing to give the country an opportunity to feel a part of the process, because we truly believe that the solution lies with all of us. The personal responsibility, the observing of the respective restrictions, the calling and providing information, the home quarantining, and of course the cooperation with the public health personnel on the ground in communities or in the respective institutions.
Jamaica, and indeed the world, is of course still grappling with the COVID-19 pandemic. As government works to contain its spread, persons are being advised to take all the necessary safety measures. We recognize that this can be overwhelming. So here are a few tips to maintain good mental health during this time.
is normal to feel sad, stressed, confused, scared, or overwhelmed during a crisis such as that caused from the COVID-19 pandemic. But there's no need to. For one, we must first inform ourselves about this disease through reliable sources to determine our risk and precautions to take. This can go a far way in calming our fears and ensuring our safety. Keeping in touch with family and friends and talking to people you trust, even as we practice social distancing, can help prevent panicking and keep you in good spirits. If you must stay at home during this period, try to maintain a healthy lifestyle of proper diet, adequate sleep, and regular exercise. Don't use smoking, alcohol, or other drugs to deal with your emotions. If you feel overwhelmed, talk to someone about it, a healthcare provider or counselor that you can call. Ensure that you're fully engaged in something constructive to occupy your time. An arrangement with your employer to work from home where possible is good in helping to keep up normal daily routines. Limit the time you and your family spend watching, listening, or in conversations about COVID-19 that you perceive as scary or upsetting to avoid being overwhelmed. Make sure you are in the know generally, but try to engage more in other things or change the topic of your conversations to things you enjoy talking about. Draw on the skills that have helped you manage previous adversities. It's important to try to maintain some sort of daily agenda so that the days are not wasted and you'll feel more accomplished. Focus on activities that make you feel happy, like reading a book, watching your favorite show, playing video games with your family, or telling stories. Do some gardening or chores around the home too. Children too need to be provided with the information to help them understand the risks without becoming scared and confused. Use age-appropriate language to teach them about hand washing, cough and sneezing etiquette, and social distancing. It's also important to reassure them about what could happen if they start feeling sick and may have to go to the hospital so doctors can help them feel better. In the meantime, ensure their learning continues even as schools are out. And give them extra time and attention. Listen, speak kindly, comfort them, and of course, make time to play. When it comes to easing fear and anxiety around COVID-19, just consider that once we do what's necessary to protect ourselves and prevent spread, we should be well. If we do get sick, rest assured our doctors are trained to manage the illness and help us recover. And yes, while we maintain proper cough etiquette, cover our noses when we sneeze, and practice social distancing, we must treat each other with care and respect. Don't be startled by every cough or sneeze. Remember, not everyone who does has the virus. Take care of yourself, support others, don't panic.
COVID-19 is a major priority for the government right now, but so is the long-term infrastructure development of the country. One of the projects meant to drive economic growth is the Port Royal 2020 Sustainable Development Plan. In keeping with government's mandate for Jamaicans to practice social distancing to contain the spread of COVID-19, public consultations for this project have been suspended. But let's see what has already been done as we look forward to the development.
With 500 years of rich history, Port Royal is poised for major redevelopment. Port Royal 2020 is a joint government initiative that seeks to transform the town into a technologically smart, world-class heritage, environmental and cultural attraction while upgrading its physical infrastructure and improving the economic and social situation of its residents. The Urban Development Corporation is responsible for leading and coordinating Port Royal 2020, which involves the contribution of several government ministries and agencies.
We have two main roles. We're doing the master planning, which is the formal process of doing planning for a town, but we're also coordinating the efforts of the other government agencies.
Port Royal 2020 will implement infrastructure development such as solid waste management, stormwater drainage systems, water supply upgrades, sewerage, roadworks, housing, solid waste collection and disposal, among others.
This development, my friends, is going to serve as a model for the redevelopment efforts across Jamaica.
An active part of the development process is ongoing visioning sessions and public meetings with residents and stakeholders. Many of these have been led by the Social Development Commission, SDC, which facilitated 10 weeks of community meetings in Port Royal. These sessions allow for a better understanding of the roles and responsibilities of the agencies involved. They also provide a space for input and feedback from residents.
How secure will the people be when this system is put into everything?
With this new development, of course, it has not escaped the High Command, so they know what is coming, and they are actively planning to upgrade the station.
What do you plan to do to circumvent or prevent any sort of disasters happening in our marine spaces?
We're about to start a strategic environmental impact assessment related to the town and all of the activities that will happen in the town, and that includes looking at the marine as well. So there will be a formal review of that. We're not going to complete anything before we do that assessment. So the assessment will inform what we do going forward.
This is a demonstration of the effort to make sure that your recommendations form part of this development process.
And for transparency, the UDC has launched the portroyal2020.com website. The platform provides comprehensive details on the project and allows for questions and sharing of comments. Port Royal 2020 also envisions greater economic independence for residents and has begun skills training sessions with them to support this goal. Through partnerships, close to 100 residents have been trained in the batik art form, textile, printing, jewelry making, and the culinary arts.
Complementary to those skills are the requisite entrepreneurial and business skills. So we are not just teaching skills, but we're preparing them to be entrepreneurs, to be able to function in this new environment, in this new economic program.
These are skills that came in handy for the arrival of the Morella Discovery 2 cruise ship on January 20 and February 24. The new cruise port is central to the project and was constructed by the Port Authority of Jamaica, PAJ. It also serves as an additional gateway to Kingston by cruise liners via the historical town.
In due course, when the volume begins to build up, yes, we will have a number of opportunities there for permanent shops. On cruise ship days, there's going to be a lot of activity with pop-up tents and craft vendors and so on.
Beyond the port, we're looking at waterfront developments in the town. We're looking at attractions, a series of attractions. So Fort Charles is already being redeveloped. We're looking at Lime Street, looking at the Old Naval Hospital, looking at how we bring those together into a formal tour.
Master planning for Port Royal 2020 is at the fourth of 5 phases. The team is now finalizing the master and town management plan, as well as approvals for the activation of an enterprise team and consultations. The Urban Development Corporation, making sustainable development happen for you. To learn more about the work of the Urban Development Corporation, call 876-656-8031 or visit their website at udcja.com. You may also follow them on Facebook, YouTube, Twitter, and Instagram, or visit their information center on the ground floor, Kingston Mall, downtown Kingston.
Tip number 1. Keep your regular medication and other supplies well stocked. Ensure there is access to several weeks of medications and supplies in case there is a need for you to stay home. Monitor food and other medical supplies needed and create a plan in the event that such resources become depleted. Tip number 2. Stay sanitized. Tip number 3. Respond to multi-generational living situations. Many older adults live in homes where other members, such as children, may have frequent colds. Therefore, do not share personal items like food, water bottles, and utensils. If possible, Choose a room in your home that can be used to separate sick household members from those who are healthy. Tip number 4. Develop intentional caregiver plans. Older adults may be caregivers or may receive care themselves. Caregivers and care recipients should discuss their preparation plans, including how to stay in touch via phone or email. Determine who can provide you with care if your caregiver gets sick. And tip number 5, keep abreast of essential up-to-date information. That means you should find and regularly check a trusted information source.
The Ministry of Labour and Social Security has been working assiduously to help to contain the spread of the dreaded coronavirus COVID-19. And I believe that it is my duty as Minister to encourage employers and business operators to put the proper mechanisms in place to protect workers and customers and themselves. Workers are the most important part of any organization, and they must be given all the necessary information, tools that they require to ensure that they can utilize the best safety and health practices. During this period, workers might be required to be quarantined or isolated for an extended period. In these instances, we are recommending to our employers that you exercise discretion beyond the provision of the Holiday with Pay Act 1974. We are also imploring employers to consider making use of the provisions under the Flexi Work Arrangement 2014 in order to ensure that where possible, staff can work from home, creating far less risk factors. I believe that as a nation, we have a responsibility to work together for a healthy and safe work environment.
This is where our journey ends, but only for today. Do join us again tomorrow when we'll bring you another informative program. In the meantime, stay connected via our website, jis.gov.jm. And while you're online, send your feedback to Jamaica Magazine at jis.gov.jm or via tweet at JIS News. On behalf of the entire production crew, I'm Adrian Atkinson. Thanks for watching.
This has been a production of the Jamaica Information Service, the voice of Jamaica.